a few things, and perhaps other people will join us because I'm already 15 minutes into my allotted time for this. Hang on one second. So yesterday, um, we had a pretty good discussion about the um, role of sulforaphane with helping with T helper cells. And so it's turning out that one of the interesting things that I learned today from reviewing the research on this particular virus is that I saw some literature that said that the people most at risk for um, having this persist into the coronavirus is the people tend to have lower T cell counts, and so it really makes sense what we were talking about even more yesterday to have sulforaphane on board during this potential threat, because it will help raise T helper cells. So just going to repeat that just for the person who just joined us, is that I came across some research today, and I think it's covered in the material I'm going to talk about, that the people who have had the most at risk for this virus seem to fall into a subset of people who have um, low T cell counts. And so yesterday when we were talking about sulforaphane helping with creating T cell, helping with Th1 populations, this even makes more sense as to why to use this for preventing viruses, or and also to help fight a virus if it actually has started. So today I'm going to kind of back up a little bit even more with just to understand some terms, because it's been fast and furious since this has all started, and I think it's really important for us to kind of understand exactly what we're dealing with um, when it comes to kind of the basics of understanding the terminology that's being thrown around. And then so I'm going to share a document that I've been reviewing today. Just a second here. Okay, so I just want to share this particular document that I started reviewing because I think it's really good, because there's terms going around. One's called SARS-CoV-2, and then everybody's hearing the COVID-19, and these are the two different terms that are going around. And I thought it would be really important to point out what these terms actually mean, because if we're just running around saying, this person has COVID-19, that doesn't mean anything. So let's first go through these terms, and then we'll go into important ways to prevent it. So SARS-CoV-2 is the name of the actual virus that causes this viral illness called coronavirus. So when they're looking into identifying and testing this particular strain, this is the test. They're trying to identify the presence of SARS-CoV-2, which is an abbreviation for severe acute respiratory syndrome coronavirus 2. So the coronavirus that has this acronym is SARS-CoV-2. So when you're reading about testing and how to be tested for this is what we're learning. And seems to be two types of viruses. One that was in the early stages in Wuhan that was aggressive, and then it kind of slowed down. And then there's a less aggressive type that's making up 30% of the cases in China. And so I think we're starting to see different variants here as well. And so as we get an understanding as to which variants we need to be most concerned about and which we don't, it will help us kind of reduce some of the fear and issues that are present right now. So let's go into COVID-19. So there are 7 coronaviruses that can cause human disease, and we've heard over the past couple decades of SARS, MERS, and now COVID-19. COVID-19 has been spreading faster than SARS and MERS, but it doesn't have as high of a mortality as these other viruses. And so that I just want to point out that there were some previous coronaviruses that had higher mortality than this last one, but this one's is kind of spread faster. And COVID-19 has a higher fatality rate than the seasonal flu like rate, but more people have died from the flu than COVID-19 at this point, but it has a higher fatality rate, meaning like if you get it, the fatality rate is 2% versus the flu is 0.1 to 0.2%. And so those are some things to know about. I think people know at this point that the incubation period of this particular virus is 2 to 14 days, and with some extreme measures that it can be 24 days. So that means that by the time one person is exposed, they should be, if they were to be exposed, the symptoms would likely appear between 2 and 14 days. You can be infected for a little while, up to 5 to 6 days without feeling sick. So even if you're not feeling sick, we should act in the way as if we may have it and might transmit it to others. And so just that's probably going to be our most successful way to get this thing under control in our community, is just for all of us just to act like we have it in a way, maybe not to the extreme, but to the sense that we're trying not to expose others to our hand germs and try not to touch our kind of mouth. And I'm sitting here with my hands crossed because I tend to always sort of touch my beard, and it's just sort of like a nervous habit, I think. And I'm sitting here with my hands crossed to kind of protect against that. But, even though I feel well, I'm just assuming that, who knows, when I was in Trader Joe's 2 or 3 days ago, who knows what I might have been exposed to. So I'm just hanging out like I have it or not. So let's also talk about a key term called viral load. Viral load is basically how much virus per volume of fluid you have in your body. And so with the COVID virus, it seems that the virus will start to replicate, and then around 5 to 6 days after, the viral load will peak. So we can have viral load even before we have symptoms. Let's see. Another thing that you may have heard is the importance of hand washing. So they did some research that said that only 5% of people who wash their hands will wash their hands long enough to kill infection-causing germs. So that's 20 seconds. And if you want to kind of watch me, because I don't know if you've seen the WHO video that I sent out earlier, but essentially, there's this sort of process of washing your hands, and it's much more complex than just kind of what we all used to do, is just kind of wash your hands together. So you have to kind of intertwine your fingers, and then take your nails and kind of scrub the palm of your hands back and forth, and then actually rub your knuckles against the back of your hands. And the final move is kind of your thumb between your hand. All that should be doing over 20 minutes. And then when you grab a towel drying off, and then if you're going to turn, dispose of the towel, and as far as like doorknobs and those types of things, you shouldn't be taking what you just washed off with your hands and touching a doorknob with it, because that doesn't make sense. So just kind of do your best to keep doorknobs clean with cleansers or antibacterials, but washing your hands will likely prevent most of this. I think there's a fact I can show you later. So washing your hands, trying not to touch your eyes, coughing into your elbow, these are all great things. So the interesting thing about the coronavirus is it has spikes, which makes it easier to bind to target tissues. And the coating on the coronavirus also makes it susceptible to hand sanitizers and wipes and alcohol-based hand. So you can use those with some efficacy, but soap is best because it causes like an emulsifying effect that knocks the critters off your hands. This is also really important to know because of the little spikes that they have, is that things that we can do to prevent viral binding are really important. I sent out a message about supporting mucous membrane health. If you have good mucous membrane health, through things like nasal inhaled xylitol or this product's Xclear, and if your throat is coated by drinking throat coat tea and you try to prevent any kind of dry mucus areas, that's going to be really hard for a virus to bind to. But the more dry your mucous membranes are, the more it's easy for viruses to bind. So I've talked a lot over the last few days about different treatments to do, but I'm going to pause for a second and open up questions to see if you guys have any questions. So I think you can raise your hand with the app, or if you have any questions, you can chat it into the box. So okay, I'm just seeing if you have any questions today.
Are you talking to Heather?
Yes, yes.
Okay. Well, the Xclear thing that you just mentioned is really interesting. That's something my husband uses all the time for his allergies and sinus problems. Is that something we should do preventatively? Just start using that?
Yeah, I think it makes a lot of sense, to keep the, I'm going to take you off mute for a second. It does make sense to use Xclear preventatively. And I think it's similar to if you were to do like a nasal lavage, but even almost better because it provides a little bit of a gel and epithelial layer healing component. The xylitol promotes healthy mucus. And xylitol is also anti-allergy. So one of the things that we've talked about this week is that the less that your immune system's dealing with, the more ready it will be to fight a virus. So if you have allergies using Xclear, it serves two purposes. One, it will knock down any type of nasal inflammation and knock down allergic responses, which lowers the immune system's Th2 response, which frees up some Th1 activity, Th1 being what fights viruses. And two, it puts more mucus secretions into your nasal cavity, preventing binding for this virus. Does that help answer the question?
Yeah, that's great. I'm gonna buy some. Thank you.
Yeah. Any other questions before?
Um, Not at the moment. I'm just kind of listening in.
Okay, sounds good. Okay, YC, do you have any questions?
Not yet. We do have upcoming travel, and so I was going to ask you about that later, but they're just listening in like the other.
Okay. Yeah, I'd like to kind of talk about that. I mean, could you just clarify when your travel is going to be? Like, is it
So it's the end of this month, and then again next month as well.
okay? Okay. Yeah, I mean, I think the travel thing is. I know that I got a message from Alaska Airlines that supposedly they're doing kind of some good preventative moves. I'm pretty sure that the people that are traveling these days, like the amount of sick people that are traveling as far as is going to go way down. So it's probably going to be safer and safer. But, I think all these things I'm talking about right now really apply. And I think the having at your disposal like wipes for the place where you sit down in the plane, alcohol wipes, wiping down your table that you're sitting in, even the screens that you touch for like watching movies and watching games. Um, you know, uh, I would suggest that it may even be a good idea to bring a mask for traveling. I know that the airports and airplanes are doing a lot of preventive measures. I'm hoping that by the end of this month, we'll have less of a fear environment and more of like, okay, we know what we're dealing with. And but if you're immunocompetent and you're not on any immunosuppressive medications, I would say it's probably a similar risk as if you're going to a public event. Public events are, but probably with slightly higher because it's a closed environment. Um, but if you do really aggressive preventive measures and take your supplements, I think it's a calculated risk. But I definitely wouldn't recommend travel for anybody has immune issues and um, has any of those pre-existing conditions that seem to be most affected, like diabetes, hypertension, um, and pre-existing conditions of like immune suppression. So, all right, well, I'm going to jump back to this document that I'm reading through with you. Hold on one second. All right, so one of the things that's not on this, I just want to say that I've thrown a lot of ideas at you this week so far, but I think the ones that are really solid still are the Th1 support. We've got like the sulforaphane and berberine, I think are really good, and the mushroom supplements, the Stamets 7, all those are really good for priming the body in case the virus enters and starts doing its thing. And then the preventative moves of washing your hands and sleeping and exercising and not touching your mouth and eyes, and kind of avoiding excess public exposure, those are all really good to prevent attachment. And zinc, if the virus gets into your body, will prevent viral replication. We've covered a lot of good strategies so far. So I think we've done a really good job. Like NAC, we've talked about with boosting glutathione, and also it's a mucolytic. So if the virus does start using mucus to hang around and cause inflammation to distract the immune system, NAC is really good for helping that. Also, NAC is a precursor to to glutathione. I'm really supportive of people drinking teas during this time of year, like ginger tea, ginger honey tea would all be really amazing. Throat coat tea that has like slippery elm to keep the throat moist, and just really focusing on sleep. I just want to go back to this kind of bottom line here, that only 5% of people wash their hands long enough to remove infection-causing germs. Imagine if that's the case, and this thing, was in our population for like 6 months. I'm sorry, 6 weeks or so, and all the people who don't wash their hands well, we're just kind of passing this around. But now, if we're really vigilant about this, then that could be really enough to knock this out of our population fairly soon. So if anything, the silver lining of this is that hopefully through all this, we've learned that we need to wash our hands. In fact, today I had a visit with a longtime patient, and we, instead of shaking hands or even doing like a fist bump type thing, we just kicked our foot together, because I saw that on this video from China, that's how people are greeting each other. But it was cool because we both understood, and we both were able to greet each other. But various things, who knows, we may be on top of this before we know it, just by all the education. Okay, well, we are just about done, and I'm just gonna open it up for any last questions. I'm gonna start with YC. Do you have any more questions for today, YC?
Just about that supplement, the TH1. I think I couldn't get it online or something. Did you have that in your office?
So I have, what I do have in my office is something called innate immune support. And this is kind of like the Stamets 7. This is this one here. It has astragalus and beta-glucan, mushrooms, reishi, and andrographis. So like the Stamets 7 would be just as good as this. As far as the TH1 support, I'm just really wanting people to do the sulforaphane that I talked about yesterday, primarily, and then also taking berberine. I do have like a berberine blend called microcidin that would be adequate for TH1 support. It has oregano, garlic, cloves, and berberine in it, and so this would be the one. So if you do want me to set some aside for you, these two right here would be really good for right now. But if you got the Stamets 7, you just would need to add this one and then get sprouting with sulforaphane. Does that make sense?
Yes, makes sense. Can you set those two aside? Like, is your office open tomorrow, or I can just get it from the front desk?
Yeah, I'm open to tomorrow, and I can just put them at the front desk.
Okay, thank you so much.
Yeah, I'm here today too, so just if you could message me when you'll be by, that'll help. I'll get them ready for you.
Okay.
Okay. All right. Okay. HM, any questions more before we wrap up here? Oh, I'm sorry. Yeah.
Bro,
is that okay?
can you hear me? Sorry. Yeah, I do have a question, and this is a little bit less for me because, as you know, I'm on a million different specific strains of probiotics. But is there something over, like, just a good baseline probiotic that you can recommend that I can put my family on? Like, I'm worried about them being out and about. My dad's getting like surgery and has to take antibiotics. And I'm just like, what can I buy them that's a good, solid baseline?
Yeah. So let me just mute that for now, and I'll answer your question. So if someone's going on antibiotics right now, the best one would probably be Saccharomyces boulardii at the levels of, depending on body weight, either 250 milligrams twice a day or 500 milligrams twice a day. The issue with probiotics after antibiotics is that we're now moving away from recommending probiotics right away. We are encouraging people to take a Saccharomyces boulardii with the antibiotic if they need to go on them. That's an anti-yeast. But the other thing about Saccharomyces boulardii is it works sort of like beta glucans, and so it helps with the immune system. It helps promote natural killer cell activity. It also helps with preventing leaky gut, and it also prevents from candidal overgrowth. You can imagine if you want your immune system to be at its best right now, the last thing you want to do is develop yeast overgrowth, because that's another thing the immune system has to deal with amongst all the bugs that are going around right now. So that would be the one. Then 2 weeks after being on an antibiotic, then the probiotic that I like the best, that just kind of covers immune system, digestive system. The one that I'm currently most in favor of is this one called Lacto Prime Plus by Claire, and it has really good strains of Lactobacillus and Bifidobacterium that covers sort of the gamut of what you would need for prevention and immune health. That one's probably it, but I would wait a couple weeks until the what we're learning is, and this is very new data, is that if you take an antibiotic and you just stop after you're done taking the antibiotic, if you let the gut microbiome just do its thing and kind of regrow, it'll kind of come back somewhat to where it was before in 2 weeks after you've taken the antibiotic. We're learning that sometimes if you take a probiotic right after you take an antibiotic or during when you take an antibiotic, that it can actually slow that regrowth and it doesn't kind of come back as robustly. So we're telling people to wait 2 weeks after their probiotic, and then, after their antibiotic, then start their probiotic. But the exception is Saccharomyces boulardii. You can take that with your antibiotic because that's not going to have any of this ill effect, and it's not going to interfere with the antibiotic, and it's also going to prevent yeast infections and prevent leaky gut and support your immune system. So that one's an amazing one. Does that answer your question?
Great, thank you. I'm glad I'm taking it.
Okay, yeah, it's awesome. It's a good one. Okay, I'm just going to go down to the next person here. Okay, RC, you're on the line with us here. I just want to see if you have any questions. Hello? Okay, I can't hear him, so I'm just gonna, we just went through a whole presentation and we're just wrapping up, but let me just grab on to one more question. Okay, I don't know who this is, but your initials are KTB. If you have any questions, feel free to chime in. KTB? Hi.
Chiming in late, so I was
Okay.
just listening in.
Oh, yes. Hi. Do you have any questions for that you've been just wanting to ping us about or anything like that? We just went through a whole thing.
I missed everything. Oh no, just because I work in the health field, I thought I would just try to see if I could glean a little information.
Yeah. So I think that the biggest thing is with anybody working in the health field is, and I'm sure you're doing this, but just the hand hygiene and
Yep.
we went over earlier that only 5% of the population, and this would apply to your clients and
Mhm.
to your other healthcare providers, only 5% of the population is known to wash their hands for the required 20 seconds.
Wow.
So you can just assume that everybody you're meeting, like almost everybody except, hasn't done what they should do to prevent this from passing. Now that's probably changing because of all the awareness that's around right now, but to make sure that you assume that the person you've met with, so I wouldn't shake hands with people right now.
Okay.
I do like an
I mean,
elbow bump.
elbow bump.
I mean, whatever you can do. But
So
it's,
in session, if I'm, for example, working on somebody who has carpal tunnel, I clearly am going to touch near their hand, on their hand. Would you recommend? I mean, I don't think people would be offended if you asked them to go ahead and wash their hands before starting the session, but I don't know how preventative that would be.
it would be highly preventative.
I mean, I think it would
Yeah.
help.
No, I think you should show them how to do it as a healthcare provider. Take them through the World Health Organization technique and watch them. I'm sure they'll be highly appreciative, and then everybody's protected, and then they've learned something.
Okay. Thank you.
Yep. Okay. All right. Well, I'm going to go to one more person, and then I think that's it. So, okay. RC, do you have any questions? Hello, RC? Hello, RC? I guess he doesn't have any questions. So, all right. Well, thank you guys for tuning in. I'm going to just sign off here. I think tomorrow I'm not 100% sure there's going to be a session, but if there is, I'll send out a message. And I hope today, just in summary, let me just put this back on the screen. So in summary, we went through some key things about the coronavirus, and just to know the difference between, oh, I'm missing. Hang on one second. Okay, just to know that when you're listening to these terms, we talked about the difference between SARS-CoV-2 and that SARS-CoV-2 is the name of the virus, and COVID-19 is when, COVID-19 is the infectious disease name for a virus caused by SARS-CoV-2. And we talked about that there's now, when they're testing, they're finding several variants of it, and that SARS-CoV-2 is going to have a more aggressive type, and there's going to be milder types that are going to start to show up in the community. Then we talked about COVID-19 and that there's 7 different types of coronaviruses, and that in the past there was one called SARS and MERS, and those were much more aggressive and more fatal than this one. But the reason why this one has been so concerning is because the rate it's passing on to people, and so it has a higher fatality rate than the seasonal flu, because the people who have got it have had a higher fatality rate. Even though there's been more people that have died from the flu this year, the people who have got this COVID-19, there's been a higher fatality rate, like 2% fatality rate, versus at the flu, it's like less than 0.1%, less than 2%. And then, so we talked about the incubation period, and that how you could have it for all purposes. All of us could have it. I mean, we're all part of this here, and have no symptoms at this point, but like 5 or 6 days from now, the symptoms would appear. So we talked about how right now you should just act as if you are sick with this and do all the preventative measures and treatment measures that we've outlined this week, just to assume that you have it. Like if 2 to 14 days go by, and as those days build and build and build, you can sort of drop off the concern as the public health officials sort of validate that. But like right now, washing your hands as if you have it, not touching your eyes as if you have it, not exposing yourself to others, coughing into your elbow. These are all things to be doing right now, because it could take 5 to 6 days of having this virus in your body before you know you have it. And really, like, why shouldn't we live somewhat like this all the time? That's one of the take-home messages. And talked a little bit about viral load. I talked about how this coronavirus attaches to tissues really well, because it has, it's called an envelope virus with spikes. And so it can bind to nasal passages and throats and eyes really easily, lungs. So that's why I want to go back to the beginning of the week when I sent out that memo that had a link to how to support your mucous membranes. Make sure you review that. And we talked about how xylitol spray might be a really good thing to do right now because it will knock down allergic reactions. It will also reduce the dryness of the mucous membrane, which if a virus hits dry mucous membrane, then it's game on for the virus. And then we talked about how this particular virus, washing your hands is really kind of the best way, because having soap on your hands knocks down the surface area for, it will kind of knock the critters off your hands and be the best way to protect your hands from carrying virus. Soap is the kind of surfactant aspect of soap will do that, but also alcohol wipes will have some efficacy against this particular virus, but not as good as soap. And I'm not going to review all the supplementation because we've talked at length about this, but again, Th1 support with things like sulforaphane, which I talked about yesterday, and sprouting with broccoli sprouts. Proper preparation of broccoli will help your immune system with the Th1, which is the viral approach, and also supporting natural killer cell reactions to the virus with the mushroom blends like Stamets 7s, Th1 support with berberine, oregano, also clove and garlic. These are all things that will help with this immune response. And so those were the key things. But number one, again, washing your hands. So I feel like a broken record. But anyways, thank you so much. I got to get off here. If anybody has any questions afterwards, you can email me and I'll be happy to respond over email. This is a process for all of us healthcare providers. So any questions, a good question. A lot of us are learning more and more about viruses. That's one of the silver linings, is hopefully this will teach us what we can do to prevent disease in the future, and we'll be much, much better at it. So thanks a lot. I'll try to be on tomorrow. It looks like it's not going to happen just based on scheduling conflicts. But if I am on tomorrow, I will send out another announcement. Thanks so much. Take care, you guys.